Chair is authorized to declare a recess at any time. Welcome to the first hearing of the Committee on Oversight and Reform for the 116th Congress. Before I begin, I want to thank Ranking Member Jordan and his staff for agreeing to accommodate this hearing. I know that we are taking a lot of time today, but I truly believe this is one of the most important issues facing our constituents, and it is one that demands immediate attention. I will now recognize myself for an opening statement. Today, we will examine the actions of drug companies in raising prescription drug prices in the United States, as well as the effects of these actions on the federal, state budgets, and on American families. Before we begin, I acknowledge that there is a lot going on right now here on Capitol Hill and across the country. Until last Friday, the federal government was in the midst of the longest shutdown in United States history. Hundreds of immigrant children, and possibly many more, are still separated from their families. The latest of President Trump's longtime advisors has been indicted on criminal charges. But today, for our first hearing, I wanted to focus on one of the biggest problems facing American families across the country: the actions of drug companies that have been aggressively increasing prices on existing drugs and setting higher launch prices for new drugs, all while recording windfall profits. 2 weeks ago, the committee launched an investigation into the prescription drug prices to determine why drug companies are increasing prices so dramatically, how drug companies are using the proceeds, and what steps can be taken to reduce drug prices. Our first witness today is not President Trump's personal lawyer, Michael Cohen. No, it's not Michael Cohen. It's not someone from the White House or even someone from the Trump administration. Contrary to what some have claimed, that never was planned. The first witness to testify before the Oversight Committee is Antoinette Worsham. Ms. Worsham is a working mother, listen up, whose daughter died. 22-year-old daughter died tragically when she could not afford to pay for the insulin she needed to treat her diabetes and instead began to ration her medicine. It would have cost $1,000 for 3 months of insulin. She died. And I know Ms. Worsham will share her story, and it's not easy to testify. But as I said to her, I thank her for taking her pain, turning it into her passion to do her purpose. I also want to thank you for being here to share your family's story with us. You are not alone. Researchers at Yale University recently found that 1 in 4 patients with type 1 or type 2 diabetes, and I quote, have reported using less insulin than prescribed, end of quote. So when you testify here today, you are representing thousands upon thousands of your fellow Americans who are suffering from the same worsening problem. I also want to thank our other witnesses for being here with us today. We're grateful to have Dr. Catherine Georges of AARP to speak on behalf of American seniors. And I want to thank all the members of, I asked my staff who was all them people in the red, and I'm glad to see you all. We also valued the expert testimony of Dr. Jerry Anderson and Dr. Aaron Kesselum and Dr. Avak Roy, Dr. Roy for being with us today. I've been waiting a very long time to hold this hearing. For the past decade, I've been trying to investigate the actions of drug companies for all sorts of drugs, old and new, generic and brand name. We've seen time after time that drug companies make money hand over fist by raising the prices of their drugs, often without justification and sometimes overnight, while patients are left holding the bill. The pharmaceutical industry is one of the most profitable in the world and one of the most powerful. 14 drug companies each made more than $1 billion in profits just in the third quarter of 2018. And they have the best lobbyists money can buy. Let me be clear. There are powerful interests here that do not want us to interfere with those massive profits. But there's a strong bipartisan consensus that we must do something meaningful to rein in the out-of-control price increases. Even President Trump has said that drug companies are, quote, getting away with murder, end of quote. But tweets are not enough. We need real action and meaningful reforms. We all recognize that research and development efforts on groundbreaking medications have made immeasurable contributions to the health of Americans, including new treatments and cures for diseases that have affected people for centuries. But the bottom line is that the ongoing escalation of prices by drug companies is simply unsustainable. This is a matter, literally, of life and death, and we have a duty to act now. Our constituents are demanding it, and I am grateful that we are finally starting down the road with this hearing.